And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Man, I'm steady talking and I was on mute. Well, welcome everybody to Keeping It 100, where we have these open and honest conversations that make sure you have the information you need to make good health decisions. I am your host, Dr. Kristin Motley. Always glad to be here. And as always, if you think of questions, want to have comments, pop them in the chat, give yourself a shout out. We'll give you a shout out. We'll keep an eye on them. Dr. Tyan Thomas is behind the scenes. Keep an eye on the chat. She's going to be in front of the scenes. Keep an eye on the chat. She's on double duty again today. Dr. Thomas. Thank you.
Hello.
Thanks for always being here for me. I appreciate it.
No problem.
George on his way to a whole nother land. He hopped on from the airport. I was like, yo, bye. Go on vacation. His wife surprised him with the vacation for spring break. So that is amazing. Shout out to Tracy for doing that. They are en route to a whole special private island getaway retreat. So he deserves it.
That's dedication. He talking about, I'm going to be in this airport on here doing the show.
He was. He absolutely was. I was like, George, I appreciate and I see your work ethic. You are all like, that's just how he is. He the bomb. Thebomb.com. So yes, take a break. Dr. Thomas is here. She's always here. So welcome back to the main stage, Dr. Thomas. And G and Tracy, please have every bit of great, free, enjoy romantic time. Get your groove on and get your groove back. Just have a good time. And we'll see y'all when y'all get back. But Dr. Thomas, I know your boys are on spring break this week, right?
Yes, they are, and I'm not. So, man, how did I thought that was going to work?
That is so funny. I usually try to take off during spring break. We try to go away somewhere. Do y'all have any plans?
No. So I'm lecturing tomorrow, so I couldn't take off on the Thursday. Yeah, we would have had to leave the weekend, come back early. So so they're home, but it's good. I've been doing outside stuff with them. Thank goodness the weather's finally breaking.
Yes, it's the perfect week. It's the perfect week to do that.
Yeah, and then they're coming up to the school with me because one of the student orgs that I advise is having something this evening. So I had to kind of promise some basketball cards. So I'm like, when did this happen where you gotta coerce them and give them gifts to get them to do stuff?
I was thinking about that today. I was like, Bria, I had signed her up to do golf again this spring. Oh, we talked about it last week. So she's all signed up, ready to go. And I told her it starts in a couple of weeks, and she was like, oh, I don't want to do it. And I was like, what am I going to have to give her to get her to go? Like, why can't I just be like, you're going because I said you're going? But now I got to fight her. So now I'm like, I don't feel like fighting Bria. What can I give her so that she can just go?
Yep. Same thing here. Lord.
It is ridiculous. Well, hope you guys get to, continue to enjoy the warm weather and you figure out all the incentives because you got 3 of them to incentivize. So hopefully it doesn't cost you an arm and a leg.
That's my second job, man.
Bria's on spring break next week, so I'm taking off a couple of days next week, and we're actually going to do an overnight trip to Baltimore. We're gonna go to the aquarium. Ooh. I know that's your hometown. Do you have any recommendations? Like, what should we do while we're in Baltimore?
Yeah,
we're gonna be there for 2 days.
Quick thing. I worked at the aquarium in the gift shop all throughout high school. That was my and through part of college. So I love the aquarium. So the aquarium's good. I'm not sure. I like the science center, but she has the like science, the like it because
You
it's,
love
you know what I mean?
science.
Yeah.
Yeah, yeah,
So
yeah.
they have like what do you call it? When you look out at the stars, I forgot what the name, planetarium there, or they
Oh, okay.
did. So that would be, and they're all there in the harbor together, so you can like walk back and forth between the two. Sorry,
Perfect.
that's one of the kids now.
That's okay.
So yeah, so that and so a lot of the stuff is down there together. So even if you just kind of walk around, you'll hit some nice stuff. But yeah, I love it. Yeah, you guys will find a lot of things to do there. So yeah, 2 days
Yeah.
will be enough time. I think you have enough time.
Okay. I hope so. I was trying to stay longer, but Bilal has a film deadline project and he got to get back to work. And I'm like, why your stuff interfering with my stuff? So we got to get back so he can get his deadlines meet and he can make it to Hollywood. So I'm okay with that. So we're in April. It's the first week of April. It's Child Abuse Prevention Month. So every week this month we're going to do a topic to help parents take better care of their children. And I'm gonna be over here taking notes because I'm already trying to figure out how not to hurt this child that don't want to go to golf, and we're trying to make her life better. But
Same here. We need a manual or something. They haven't made that manual yet for parents.
oh my goodness. But first let's just hop over into some news. We're not gonna spend too much time here because child abuse. We have a pediatrician on today who was going to share lots of information about her experience in dealing with child abuse and addressing child abuse. And so I want to make sure we spend a good amount of time on that. But I just wanted to mention that Noah finally got the last dose of his COVID shot. It was a 3-part series. I think we have a vaccine. I know that was pretty traumatic, but he got it and it's over. And he doesn't even remember anything about it. But I want to let you all know it's not too late to get your children vaccinated against COVID. It's not too late. I just got a call yesterday about where can someone go to get the COVID vaccine. So you're never too late. Get caught up. It's okay. And it's a good time to just be protected, have that peace of mind. And so much new data is coming out about long COVID. We've been talking about that every week. It will help decrease your risk of having long COVID, especially for those who are high risk. If you're a woman, if you're above the age of 40, obese, chronic health conditions, we've gone over this. Please make sure you're doing what you can to protect yourself. You just cannot wait. And you can't wait until you get it to do it because it may be too late. Also want to remind you that Medicare renewal started April 1st. Now, this is the first time Medicaid has been through this process in a couple years, so they may take a while to get to you or they may not. But whatever you do, make sure you have your current contact information because if they don't have your correct phone number, the mailing address, then you may not get the notification and get the opportunity to do your renewal on time. And then when you show up at the pharmacy, you may not have your prescriptions covered, and then you're going to be met at the pharmacist. And they're my brothers and sisters, and so I don't want you giving them headaches about something that could have been prevented if you just call the Medicaid office and make sure they have your information. Take a minute to do that. And we will put the numbers in the chat for you. Dr. Thomas, I'm popping that over. And while you're doing that, we'll get those in the chat for you. I will bring in our guest for today, Dr. June Messam, the sweetest lady of all time. I wish I knew her like 10 years ago so she could be Bria's pediatrician, but I already have established rapport with her pediatrician. But soon as she mess up, Dr. Messam, I'm coming. She got one time.
No, it's important to be with someone who gets to know you, know your family, know your health issues, and whoever that is, that's the person you need to be with.
Thank you. But she got one time. I want to give you a quick introduction for people that do not know Dr. Messam. She is a pediatrician, physician, and she's been taking care of victims of all types of abuse in Delaware County for more than 2 decades, more than 20 years. So she knows what she is doing and she has seen it all, I'm sure. She is also the founder of the nonprofit Every Child Counts Incorporated, and she's the president of that organization as well. Welcome to the show, Dr. Messam. I know it's been a long time coming. I wanted to have you on, and I'm so glad that we were able to make it happen today.
Thank you. And this is a great month during National Child Abuse Prevention Month. I'm super excited to be here. Thank you.
Yep, you're welcome. So just to start us off, how did you get involved in like child abuse and trauma? You're a pediatrician, but how did you kind of transition to that specialty?
So I always knew that I wanted to do something working with victims of trauma. I grew up in a wonderful little country in Guyana in South America, and it was a really tumultuous time politically. And so I was one of those kids that was hurt as a result. And I got to see other children being hurt. And so my goal was initially, things don't always go according to our plan, but my goal was to become a doctor and to go back and take care of all those children. And so I kept saying, I want to be a doctor who takes care of kids, victims of abuse. I want to take care of kids who've experienced trauma. And I went to medical school and everyone was like, dear, that's lovely.
Wow.
There's no such thing. But, you can be involved as much as you want. And so I just kept saying it and kept doing it. And then I ended up doing my residency at Crozier. I did half at Crozier, half at Shaw. Okay. And the running joke was every fourth night I was on overnight call. Anyone who was going to hurt their children, abandon their children, not feed their children, whatever it is, they were going to show up when I was on call.
Wow.
So actually the hospital at that time, our program director asked me to help to start a site at Crozier for victims of abuse. So I started that. And when I was hired, right as I graduated residency, they hired me to run that program. Wow. And I was there for a few years until they told me that I couldn't do it at Crozier because it wasn't a moneymaker. It was prior to Sandusky. So I left and started my own practice so that I could practice medicine the way that I thought it should be. And that way I could continue to take care of victims of abuse. And as time went on, child abuse became a boarded subspecialty. So there are about 20 board certified child abuse pediatricians in the state of Pennsylvania. And I'm really excited to be one of them.
And that is amazing. You literally spoke it into existence. Like it did not exist. Yeah, like it didn't exist. So when people were saying that it wasn't a thing, it really wasn't a thing.
It wasn't.
But you being such a great provider,
thank you,
advocate, and you knew what you wanted to do, the Lord was like, make it happen.
Yeah.
That is amazing.
Yeah. It actually is pretty awesome.
Yeah, that's cool. As the young people say, you created your own lane. So that's amazing.
That's what I tell kids all the time. If you want to do something and it doesn't exist, you don't give up on your dream because it doesn't exist. You simply keep at it, right? And one day opportunity is going to present and you will be ready.
Absolutely.
Just keep preparing.
Yes. Well, Dr. Messam, can you tell us a little bit about what do you do with kids who have been abused or suspected to have been abused?
Yeah, so I get referrals from Children and Youth Services or a police department or Delaware County Victim Assistance Center or Child Advocacy Center, the DA's office. I get referrals from many different people, and then we schedule an appointment and they come in, and then so now my patients who I have a general pediatric practice too, but I need to clear my office for victims of abuse. So I have to move people's appointments around all the time. They get mad at me and sometimes leave, and that's okay for me because I know if their kids were hurt, they would want me to do the same thing for their kids. So then we clear the office, and my staff and I are trained to provide trauma-informed care in a safe environment. We have amazing partners. So every time I do a child abuse evaluation, an advocate from Delaware County Victim Assistance Center, they have an advocate in my office. They're either if the parents need them, they're there. If the child needs them, they're there. Sometimes we need them and they stay and talk with us. And then we just provide care for them. And sometimes I have to refer the child to the hospital, but with child abuse, most of the times it's not an acute incident, meaning it didn't just happen. So I don't have to refer that instant. So yeah, we make sure that we do it so they feel safe, so they feel supported. I don't rush it. Sometimes they can be there an hour. Sometimes they can be there 3 hours. Sometimes they can be there longer.
I imagine you have to be able to have an understanding and a just kind of a comfort level with child psychology in a little ways, because you have to be able to build rapport or a safe space for them.
Yeah. Well, it's funny. So when I went to med school, everyone thought I was going to be a psychiatrist. And I got all these glowing reviews to be a psychiatrist. And I'm like, yeah, no, I want to take care of kids who were hurt. I don't want to do that. But I'm very comfortable with the topic. How's that?
That's great. That's great. So I guess I want to know, like, what is considered abuse? I remember, we used to get beatings growing up, and it just wasn't abuse. We just got beatings. So what is considered abuse in 2023? Because this is not how it was in the 80s. I feel like there's a disconnect. So could you kind of share, what does the man or the government or providers or what do you all consider as abuse?
Well, that's a really, really interesting and loaded question. And so I'm going to answer it in a way that will make you crazy. And so I'm going to do the legal definition and just keep referring back to that, because I don't make the laws. I would like to make the laws, but I don't make the laws. So the official definition, and it's really long, but I'm not going to read the whole thing, just the beginning, which is the definition of child abuse, was amended to require that acts or failures to act be committed by intentionally, knowingly, and recklessly doing one of the following categories. And then it goes through about causing bodily harm, about exposing children to child pornography, so it goes through serious neglect, and it's a long, they're very detailed in what is considered child abuse. So my part about it, I hear people say that, my parents used to beat me. Well, in Guyana, not only did our parents, but teachers beat us.
Oh, yeah.
All the time, right? And so, but let's be really clear, some of that is abusive. Some of it is abusive. And you're in Chester. I love the Chester Juvenile Division officers. And I mean, the things that they see, the things that we see are not what people think we see, right? And they say, I can beat my children. Yeah, but you can't bash your heads in.
Yeah.
You cannot permanently cause marks like, oh my gosh, you should not have permanent scars.
Yeah.
Right? So I think that there are ways that we can communicate with our children that are not harmful, that are not physically scarring. So don't be fooled. The cases that I work on are not, I patted them on the butt and the police is called. Okay, that's what people say. The reality is very different. And, I cannot, I won't disclose, because of HIPAA, any specific case. But there are times when I have to take a deep breath. And I've been doing this more than 22 years.
Yeah, I'm sure. But thanks for that note. So now I know I can whip this child behind. As long as it doesn't send her to the hospital, she's going to be okay.
I did not say that. Don't paraphrase me.
That's what I heard. You didn't say it, but that's what I heard, Dr. Messam.
I think she's going to be a 3-hour case. You're going to take a longer time.
Really.
Clear off the rest of your week. How can people make reports of abuse? So if they suspect abuse, how can, who should they call? How can they contact someone?
That's a great question. So, I mean, if you think a child's life is in danger, you call the police, you call 911, you
Okay.
tell them what you're seeing, you make a report. If you are not actually seeing it, but you're worried, in the state of Pennsylvania, we have this thing, it's called Childline. It's in Harrisburg, and I'll give you the number because it's an important one to have. It's 1-800-932-0313. You can easily find it online. Even for us as physicians, as mandated reporters, we have to call that number. If someone else did it, then we don't have to do it. But if you're unsure, do it. As a mandated reporter, I have to identify myself because they know who to contact. But if you're someone at home looking out the window and you're worried about a child being neglected, physically abused, sexually abused, you do not have to identify yourself. You
Okay, I
can
was
be
going to ask.
anonymous. Yes, it's really important because if it's not anonymous, there are a lot of people who are afraid to call. It absolutely is anonymous unless you are a mandated reporter. And a mandated reporter is someone who has frequent contact with children, like teachers, like doctors, like social workers, like the police. They're also mandated reporters. So there's a long list, but if you don't usually work around children, you do not have to disclose. You have to just please remember, put the child first.
Yeah, absolutely. So when people suspect that they are witnessing child abuse, should they like record it, take pictures, or just call Childline and kind of let them handle it? Like, what do you suggest?
I think that that's not one or the other kind of a question. It's a good question, but not one or the other. So there are times when videos and photographs make a huge impact on the case, right?
I'm sure.
So a child can fall down the stairs and hurt themselves, or a child can be thrown down the stairs and hurt themselves. Similar injuries, one is inflicted, one is not, right? So a video in that case would be hugely impactful. But if you see a child who is, being violently attacked, please call the police right away before you don't wait for Childline. Listen, I've called Childline and literally they're busy. So you hold, and then I'm driving, I'm calling, I'm talking to them, and in the middle of it, the call gets dropped. Right? Like if a child is in immediate danger, 911. And then if you have the video and you're safe, then you do it.
Okay. That's good to know. Dr. Thomas, did you have a question?
Yep. Dr. Messam, I was going to ask, so does the child have any say? So like if there's a report made, does the child have any say in like the outcome or how the case is handled?
So so none of us have a say, right? That becomes an investigative matter. So if you make the report goes to Children and Youth Services, and that caseworker is the first one. I mean, there are times when I'm really, really worried about a child, and then they go out and they're like, yeah, but we're not. And then nothing happens, right? But if I'm worried, they're worried, then they make a referral to the police. And then once it becomes a criminal matter, then the child does not have a say. Right? It's a crime
the
against.
child doesn't have a say once the police get involved. It just determines. So it's just based on what comes out of the investigation.
So it's a result of the findings. Understand something. So there, I see victims from birth to 18 years old, and sometimes the same child is victimized again and again and again, right? And so they're victimized the first time and they tell and nothing happens, and they're further hurt, and they tell again and it's investigated and nothing happens. And then that kid gets hurt even worse. And so they learn not to tell. That doesn't mean that they're safe. And there are consequences to abusive events, right? They don't go away. I have kids say to me all the time, I'm fine. I don't need help, right? I was one of those kids who said, as one of those teenagers, if you're struggling, that's because you're a weakling, right? It comes back to bite you at some point in life. It could be when you have children, and then it triggers the memory at a certain age, and then, oh my gosh, your life is falling apart. I get those parents who come in and they're seeing abuse and they're talking. It has nothing to do with the child. It's about them, and it will hit you at some point in time. So kids at different ages try to protect their parents. And so as professionals, sometimes it's the same as with domestic abuse, right? They'll protect the abuser, but they sometimes end up dead as a result. And so we cannot leave things up to a child. We're asking a child to make decisions that adults have trouble making. Yeah. So no, the child gets to tell us what happened. Sometimes they don't even tell us what happens. Their body says it, right? And when I'm sure that what you're thinking of abuse is not what I see.
Yeah. Because
kids get seriously hurt. And I'm just aghast at what people will do to little human beings. Right? So, So yes, kids we cannot say to a child, what do you want to happen to mommy? Do you know that year after year after year with vicious abuse, with kids who've been killed, 50% of the time it's a biologic parent. Right?
Wow.
The person who gave birth to them year after year after year. We cannot ask a child who just wants their parents' love. They'll do anything for their parents' love. Tell me what you want to happen. Like, that doesn't even come into the equation. What I will ask a child is, is there a family member who's kind to you, who loves you, who doesn't hurt you? Because maybe that family member can become a resource for that child. But never would I ask a child to make that really grown-up decision that even grown-ups can't make. I think that we ask too much of little children and too much of hurt children.
Yeah. Oh, that's a lot. Yeah.
I'm just really...
Go ahead, Dr. Motley.
You go.
Yeah, that's just such a powerful statistic. And I never realized it was that high of a percentage of the biological parent.
Yes.
And I'm wondering, so you had mentioned that in some cases, the case is referred to the police and criminal investigation. Have you observed if there are differences in how the courts treat Black children, abuse cases, compared to people from other ethnicities or other, demographics in the country?
So, yes and no. So I did a lecture for doctors about bias, right? Because one of the things that I do is review medical records. And in certain hospitals, when you walk in, if you are a Black family, they're more likely to think that you have abuse before they think anything else, even though there's a clear story. And then there are other areas of our county where if you walk into the ER, they just never see abuse. And it is absolutely based on the color of our skin. So yeah, I love giving doctors lectures and explaining to them, handle your biases before people walk in, right? Figure out what your bias is. It's a difficult thing to do, but face it before somebody dies at your hand because you've refused to see something that was so important.
Wow, that's amazing. Because if there's more reporting in a particular community, then it's going to look like that community has a higher, incidence of abuse and things like that.
Yes, and the interesting thing is child abuse is one thing that is pervasive. Doesn't matter how much money you have. Doesn't matter if you're a doctor, you're a lawyer. You can absolutely be an abuser. Mental health illness is mental health illness, and we have it regardless of what your occupation is. And sometimes caseworkers, police officers, forensic interviewers, they get frustrated with me when I don't want to know what they think before they send a child to me. You want me to see a child? Send me the child. Let me make my own opinion. I do not want to be biased by yours. And I really don't care what you think before I walk in.
Yeah.
Let them come in, let them tell me their own thing. And then afterwards, I check everything out if I need to check it out. And now sometimes in court, defense attorneys will say, you didn't call their doctor. No, because I didn't have to. I didn't have to call their doctor because it's all over their body and their doctor missed it. Or they didn't even check, right? So I'm not being a smart aleck. I'm just stating a fact. Somebody's texting me. I'm going to turn this phone off.
It's okay.
So I did. So every case is different. And I am very, very strict about making up my own decision. And you don't have to agree with me. You're going to be sorry if you don't. But you don't have to agree with me. They're going to come back. We have kids. Our goal always should be to protect the child and to stop them from being re-victimized. And sometimes just by being a victim, they put themselves in situations where they are more likely to be hurt.
Mm.
Because in order to abuse a child, you have to make them feel like they have no personal space.
Mm.
Your space is mine, right? And if you're that intimidating and you're going to do what I tell you to do, and you literally have no personal space, then you prepare them for harm in the future. Because when someone is grooming them and someone is slowly breaking down any little barrier that they have to protect themselves, they won't even recognize it because people bribe them. You want this game? Here we go. You can have it. Right? And so we have to be really careful, because I heard you guys talking about bribing your kids. You have to be really careful with bribing your kids, because you set them up for the future for people who will bribe them, but who don't love them like you do. So just be careful what the bribe is.
All right, I can't bribe the child for golf. I'm just going to pop her upside the head and take her. Won't leave no scars. I won't leave no scars.
Oh my goodness. We're going to talk off camera.
I know. Oh goodness. All right, but that's good, and it's good for us to consider that, because those are the tricks that abusers use to take advantage of our kids, and we're trying to use the same tricks that they use. Like, what sense does that make?
Yes.
Thank you for checking us. Thanks for checking us. I like being checked because I don't know everything, and so I love to learn something new so I can do things differently and just be better.
Well, the thing is, you're not using it in an abusive way. And so if you don't come from a trauma background, that's not even in your radar, right?
Mm-hmm.
But what we do people do it when they come into my office all the time. After this, you get your shot. Mommy, sorry. And I'm going to get you this and that and that. And the kids start back. And I want an ice cream, and I'll whatever you want, right? Mm-hmm. Terrible. It makes me crazy because they don't know what I see. They don't know what I see. You teach your kids, stranger danger. But guess what? Most of the people hurting your kids are not strangers. They're people that you welcome into your home. They're people that you go to church with. They're people that you would never suspect. Child abusers wear suits too, right? So just saying.
Well, Dr. Messam, I mean, this is all such hard stuff, and so how do you keep yourself kind of leveled and be able to kind of work through all of this trauma that you see?
So I love nature. And my husband figured out many, many years ago that when I was taking photographs of anything in nature, I was lost. My mind I was just trying to get that shot, and I'm not a photographer. So I don't know how to work the camera very well, but I was determined to learn. And after going through some very difficult things, we used to travel to butterfly gardens. So now my house is a butterfly garden. I save monarchs, raise them from the eggs. They come to my yard, lay the eggs, we pop the leaves off. All my family members now know my house is taken over. Conrad is so totally patient and kind and wonderful with me because he knows that I'm stressed. And so some days when it's hot and humid and nobody wants to be outside, that's butterfly weather. And so when I have a horrible case and I come home, sometimes I just go in the yard and the butterflies just swarm around me. And I feel like I'm in heaven. I forget about everything I saw, heard, photographed. And I love birds and butterflies. I travel for them. I stalk him, as my husband says. And then it's funny, he's now stalking them, running behind them, taking that picture so that he can show me. So I totally relax. And then there's sometimes when it gets to be too much, and that's where having friends who are psychologists, who are social workers, or Delaware County Victim Assistance Center. The thing I love about them is that they're always on call. And if I call and say, I had a really bad day, one of them always calls me back. So I'm just really grateful for kind, wonderful people and for loving family.
That's amazing. It's so great that you have an outlet and you have a village. Like you got it together to keep yourself together so you can continue to help these children. And so I'm really glad to hear that you have strategies in place to help you cope, because I don't even want to imagine what you see in these cases for these children.
Yeah.
So that's great. Could you share the number for the Delaware County Victim
Assistance Center? Yes. 610-891-4161.
Awesome.
Don't hesitate to call them, because sometimes trauma presents in really weird ways, right? You could be going along having a perfectly wonderful day, and someone who looks like your attacker walks into view, and you have no control of your emotions, none whatsoever. And so you want to be able to reach out and talk to them. I hope I gave you the right number I call a different number, but I think I call a back number.
Okay.
I don't want to give you any private numbers. But Delaware County Victim Assistance Center, if you look on the website, it should have a number there. That's the number you call. They will get back to you, whether it's just your trauma just happened, or it's 10 years from now or 15 years from now. So, no, Delaware County Victim Assistance Center.
Oh, victim. Okay.
Victim Assistance Center. Yeah. It's a form of Delaware County Women Against Rape. But they work with all types of victims now.
Okay. I think Dr. Thomas was able to find the website, and she's getting the resources together. Okay. Thanks, Dr. Thomas, for doing that. So check the chat. You should be getting that resource popping in the chat in a few minutes when she gets it all together. All right. So there is help out there for people. You can call the Delaware County Victim Assistance Center, and they are available to help you or to call you back if you need help. Now, you mentioned that a lot of times this happens with, people that we know. Are there things we should look for to know that to be aware that our child may be exposed or around someone at school or at a family member's house? Like what are the signs that parents can look for?
Well, if you have someone who is giving your baby a lot of attention, buying them things, getting them phones, getting them games, be really careful. Our children have a resource now that is just making me crazy, but the cell phones that they use, oh my goodness, they just type in they have a curiosity, they just type it in and it takes them to a pornographic sites. Wow. And I am just horrified at what children can see with one click of the button. And I just really want you to check your children's phones. Some people who are acting like children, are not actually children.
Yeah.
So you're looking, if so all of a sudden you have a friend who's visiting and then you see your child running and locking themselves in a room to get away. Okay, why? Why are they doing that? You don't want your child, someone coming and picking up your child to take them for ice cream. You need a break and they're doing this, and all of a sudden your child is getting more and more anxious or angry or sexually acting out
Mm-hmm.
or hitting you, punching holes in the wall.
Mm.
You changes in behavior, sometimes changes in the way that they dress, a regression of behavior. Kids who've been potty trained for years all of a sudden are wet in the bed. You know, sometimes kids will tell me, I kept doing things to make them want to not come in the room. So they will do certain things to
Wow.
keep them away, and it doesn't work, right?
Wow.
So you just have to be careful. You have to be vigilant. My job has scarred me. My kids told me, like, I didn't do sleepovers.
Yeah, I'm sure.
I let one child do sleepover at my sister's house and had a panic attack.
Oh my gosh.
And I was
I
like, this is so
understand.
stupid. But I just couldn't do it. I'm like, let me get you safely through high school, and then you do whatever you want to do.
You can do what you want after that.
Yes.
I understand that. I completely understand that. It makes a lot of sense because you know that it happens within the, a lot of time within the family. And
Yes.
so you can never be too cautious. And I'm sure your family understood. Well, I hope they understood because
Oh, now as adults, they appreciate it. I have one child who has a very loud, she's very opinionated, and made sure that I heard her, that she was an American child. And my husband and I were not raising her as American children are raised. None of the others really did that, but that eldest one, is that a no for now, Mom, or a no forever? A no forever, lovey, until when you become an adult.
yes.
And my children didn't have, all these smartphones, didn't have a social media presence. The high school made us get a social media, Facebook, because that's how they communicated with athletes, which made me crazy because we didn't allow it. My kids had flip phones. Yeah, we could have added them onto our iPhones, but no, I'm like, your brain is not developed. You won't know what's appropriate and what's not. And so, no, I'm not taking that chance. And so when they I'm like, what do you want? When you graduate from high school, what phone do you want? Right? That's my thing. Let your brain develop a little bit. And because it's scary what I see 5, 6, 7-year-olds telling me and showing me. I'll ask them, tell me how you learned to do that. And they'll say, I went on this site, and they literally spell the words, and they're telling me about a porn site. And it's so funny because I'm like, sometimes I'm like, how many times can I hear it before like I get with the program? And because they're spelling the porn site, and it's not until when I back up and look at what they spelled, I'm like, oh,
here
you
we go.
typed that?
Oh my gosh.
But yes, that's what kids are doing on our phones. And they're like, I saw my friend looking at it. I was curious.
Yeah.
And, we teach them to be curious. Let's teach them to be curious about butterflies and, birds. And let's keep kids safe. Let's give them tools that they can use, right? Let's teach them to garden. Let's get them out away from those electronic devices.
Absolutely. Let's keep our kids safe. I think that is a good way to end the show on the first week of Child Abuse Prevention Month. Thank you so much, Dr. Messam,
Thank you
for clearing your schedule and carving out some time. I hope that this information will bless many people for a long time, because we need to keep our kids safe, just like you said. Thank you so much.
Can I just point out one quick thing before we go?
Please.
You will see pinwheels These are pinwheels for prevention. I always have them up all year long inside my office, but April, you will see people planting pinwheels. They're to remind people to take a minute and remember victims of abuse. The teal one is from the Victim Assistance Center, gave it to me yesterday. It is also Sexual Assault Awareness Month.
Oh,
Right. So this is child abuse. This is Sexual Assault Awareness Month, which involves adults, kids. So I thank you so much for having me on your show and for giving kids a voice.
Of course.
All of you, be safe.
Thank you. You too. And if anyone wants to check out Dr. Messam and follow her nonprofit, where she does a lot of this work in education and helping young people, Dr. Thomas put her website in the chat. It's Every Child Counts. You can check them out at eccinc.org. So thanks, Dr. Messam, so much. And so for next week, we are going to be recognizing Black maternal mortality week. We know that there is a crisis that we are working to address. And so we're going to be partnering with the Foundation for Delaware County and the Delaware County Health Department at an event at DCCC next Wednesday, April 12th at 4:00. We're doing a free screening of the Aftershock documentary. And I'm going to put that information over to Dr. Thomas so she can get that in the chat as well. If you want to register, it's completely free. Just come out, and it's going to be a good event. We're going to watch the film and then have a panel discussion of some top experts on how we can address this issue specifically out in Delaware County. And then that next weekend, we're also going to be at Representative Carol Kazim's mental health awareness event. That's Saturday, April 15th. We'll be there from 10 to 2, providing COVID education and just general health promotion, disease prevention information. So check us out there. Remember, COVID is still out there. It's not too late to get vaccinated. You can go to a local pharmacy, contact us, and we will point you in the right direction so you know where to go to get your vaccines, to get you and your children updated on vaccines. But we will see you next week, same time, same place, right here on cmpradio.net. Thanks, everybody.
Bye, everybody.
I'm glad to hear you are protected, and thanks for being so honest here on Keep It